Hello everyone, my name is Ian Ramos. Right now I'm going to tackle about public health. Let me share to you what public health is. What is public health? Public health is the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury preventions and detecting, preventing and responding to infectious diseases. Overall, public health is concerned with protecting the health of entire populations. These populations can be as small as a local neighborhood or as big as an entire country or region of the world. Public health professionals try to prevent problems from happening or recurring through implementing educational programs, recommending policies, administering services, and conducting research, in contrast to clinical professionals like doctors and nurses, who focus primarily on treating individuals after they become sick or injured. Public health also works to eliminate health disparities. A large part of public health is promoting healthcare equity, quality, and accessibility. Now that we are facing pandemic which is COVID-19, concerning about public health is a must. Protecting and improving the health of the people and their communities can be beneficial to other people. Since this is the main issue right now because of the pandemic, the government are trying to find or prevent it from recurring again. It became an issue as the reason for that we are lacking of facilities, equipment, and product to make the vaccine. This is the facilities of the Philippines now that we are facing the pandemic COVID-19. Public health issue is not all about this. We also have problem in health. I also think this is the current issue in the Philippines. The government tends to reduce the right of the person to access they really need. Another example of public health, smoking. Even though the price is rising, there are still people that used to buy cigarettes. Besides, the effect of tobacco of the one who use it also affect the people who are around them. This calls second-hand smoking. To reduce this, we should have an area where a person can freely smoke, and the government should take an action to make the price higher in the market, so lessen the consume of tobacco. And this is the effect of cigarette smoking: cancer, heart disease, stroke, lung disease, diabetes, and chronic obstructive pulmonary disease, and also include the gum diseases. Overall, the healthcare system in the Philippines is a high standard. Filipino medical staff are expertly trained, but the facilities may not be as impressive as those found in high-end US or European hospitals. The quality of the Philippine state subsidized public healthcare, although good, varies widely between rural and urban areas. Private healthcare in the Philippines provide much more consistent care of the facilities tend to be better equipped than public ones. English is also spoken throughout the Philippines, meaning that there should be few language barriers preventing expats from accessing healthcare. Public healthcare. Doctors and nursing staff in public hospitals are highly proficient. However, public healthcare in the Philippines faces some limitation. Despite having achieved universal healthcare, the Philippines still struggle with unequal access to medical care. As such, the standard of public healthcare in the Philippines generally varies from excellent in urban centers to poor in rural areas. Public healthcare also faces strain both from treating the large number of Filipinos who rely on public healthcare and from the trend of Filipino medical staff migrating to Western countries. This has resulted in understaffing in some hospitals, and patients may experience delays in treatment. Public healthcare in the Philippines is administered by PhilHealth, a government-owned corporation. PhilHealth subsidizes a variety of treatment including inpatient care and non-emergency surgeries. Although it does not cover all medical treatments and costs. Enrolling with PhilHealth is mandatory for expats who are employed in the Philippines. PhilHealth contributions are derived from employers, employee salaries, and the state. Expats can voluntarily enroll with PhilHealth if they have residency status. And that's it. Thank you for listening and watching for this video. It's all about public health.